and good morning to all of you in beautiful Singapore. I'm going to talk about 2D perfusion, and I work as a clinical scientist for Philips. Now, 2D perfusion is a tool, it's a software, it's an angiogram analysis tool that puts a number to contrast intensity in an angiogram. And that's pretty much the only thing it does. Puts a number to contrast intensity at any place in time or space within an angiogram. And since it uses an angiogram as an input, you don't need to make extra angiograms, and you can just use the one that you were making anyway to assess the situation of a certain body site and to assess your treatment. Now here we are looking at two 2D perfusion images, one of a foot that was not treated and one of a revascularized foot. Now with 2D perfusion you can compare micro and macro perfusion and also pre and post your treatment, but you need meticulous standardization. So for example, if you're looking at the foot, you need to fixate it in the same position with, for example, Velcro to a cushion. You need to have the location of your injection at the exact same place before and after the procedure, and your injection protocols needs to be the same. However, if you do this, and the absolute values are within individuals a bit all over the place, but if you do this, then it works quite well if you let your patients service their own controls. It's a per procedural tool, meaning that you, within the procedure time, so while your patient is still on the table, you have results of this tool. 2D perfusion is an offline tool. It doesn't mean that you have to wait for the results. As soon as you made your final angiogram, within seconds you have the results of 2D perfusion, allowing you to do this analysis. Now I'll first explain a little bit how it technically works, and then I'll show you an example. If contrast flows in a certain region of interest, it does so with a time density curve. And you see one here, and on the x-axis there is the time, and on the y-axis there is the density of the contrast. There are several parameters by which you can describe such a curve, and I'd like to draw your attention to the three yellow ones. The first one is the arrival time, which is simply the time it takes from the injection point to the region of interest for the contrast to reach. The second one is the wash-in rate. So this is the speed, this is the slope of the curve, and it shows how quickly the contrast is flowing into a certain region. And the third one is the area under the curve. And the third one could be representative of the amount of blood flow in a certain region. Now, some of you might be a little bit puzzled by this, but I'll show you a patient who underwent a procedure and whose images were analyzed with this tool. We're talking about a 55-year-old male who is a diabetic and who's suffering from critical limb ischemia, and he had a recent amputation of his third toe. However, the wound was not healing well, and he came back to the angio suite and got his posterior tibial artery revascularized by balloon angioplasty. Let's take a look at the first two pictures. On the left, you have a before the treatment, and on the right, you have after the treatment. And here you see a region of interest that is drawn around the vessel that wasn't treated. So you actually can, by putting this region of interest here, and you can actually put it anywhere you like, or you can use a shape that you like, but this one particularly is on this artery. And then 2D perfusion makes a time density curve for these two regions of interest. And what do they tell us? You see that the arrival time, which is the part on the x-axis, you know, the time it takes for the contrast to reach this artery, hasn't changed. But you do see that the peak before the treatment is higher than after the treatment, suggesting that there's actually less blood flowing through this artery. And if you think we're looking at a stealing effect here, you're probably right. Now let's look at the runoff of the vessel that was revascularized by drawing a region of interest near the heel of the foot. You see on the picture already that there's probably more blood going into this artery after than before the procedure, and this is indeed what the time density curves tell us. So the blood arrives quicker at the region of interest, and also it peaks higher and with a larger area under the curve after the revascularization than before. Now, this might not be rocket science to you, since we're looking at a revascularized area, so it makes sense that there is more blood going towards this area. However, it does give you maybe some sense of what is going on with the redistribution in this foot. Now, let's look at the forefoot, where this patient had a wound that wasn't healing well, and we draw a region of interest around it. And indeed, we see that the total amount of blood flow, represented by this curve that is, has increased due to this revascularization. Now, also this makes a lot of sense. It might not come as a surprise to you. But the only thing that really matters, it's the $1 million question, is this enough? So is this increase in flow enough for this particular patient to heal his wounds? And this is actually what we're trying to find out right now through clinical studies. And we're trying to correlate the outcome of 2D perfusion metrics to the clinical outcome of patients in order to maybe have cutoff values in the end, or to show physicians who do these procedures, you know, you've now reached a 35% increase, and we've seen in the last 100 patients that that was enough for wound healing. I don't know. I hope I can tell you in the future, after we've finished these studies. So there's two main studies going on, one in the US and one in Europe, the SPA study and the PALI study. And there's also several studies running here in Asia, and many more apart from these big studies. So I hope I can tell you more in the future. Meanwhile, let me draw some conclusions. So 2D perfusion is a quantification tool. It can give you insight into the blood redistribution before and after a treatment in your area of interest. And its predictive clinical value is currently under investigation. Now, if you have questions about certain procedures or angiograms that you think 2D perfusion might be able to answer, or you just want to play with this tool, please come by our booth and have a go with it. Thank you very much.